The world of sports is characterized by frequent injuries. Because American football is an aggressive sport, these problems are more obvious. It goes without saying that it's devastating when a player you've eagerly anticipated seeing in action all offseason is forced to sit out due to illness. We apologize to the Houston Texans supporters for the awful news we must deliver today. First things first, what's the bad news? While we regret not being able to give you a good one to counter the bad news, we'll settle for a downer for the time being. Now that we've let it out, let's go. To everyone's surprise, Texas wide receiver John Metchie III has been given a leukemia diagnosis. Although the team administration hasn't formally stated if John will play in the season 2022, it's unlikely that he'll play again this year. If you're all geared up to cheer him on the field, you'll have to hold on to your enthusiasm for a while. The 22-year-old is reportedly receiving the greatest medical care, and everyone's working tirelessly to bring him back on the pitch. The treatment part could count as a kind of good news, actually, but wait for the next part because there is a silver lining. Moving on, acute promyelocytic leukemia is the precise illness with which John has been diagnosed. Allow us to emphasize that while this is undoubtedly horrible news for Texan fans, there's still hope because this is the most treatable form of leukemia. The rookie wide receiver should be able to quickly recover and play again, electrifying the field with his performances. We wish John a quick recovery. Let's hope he surprises us all with his recovery in the same way he did with his performance up till now. Fingers crossed. Up next, what does John have to say about this? John seems to have handled his diagnosis admirably, as one would expect from a Texan. The sportsman is reportedly in excellent spirits, and given his recuperation, his full attention, Metchie's formal comment on the hard luck also didn't have any sign of helplessness or frustration to it. The athlete acknowledged with courage that he might not be able to participate this season and that his primary priorities would be his health and recovery. He still has a long way to go in his career and is adamant that he will return even stronger. Metchie expressed his gratitude to the people, leaving no stones unturned for his well-being, and he also thanked his fans for their love and support, deeming it something that'll help him a lot to withstand the setback. It's important to note that while Metchie might just be a rookie at the Texans, he's a veteran when it comes to health conditions. His most recent injury occurred in December during the SEC championship game versus Georgia, when he tore his anterior cruciate ligament, ACL. So John is in good spirits and is still optimistic about having a successful comeback. And the fact that many sportsmen see an abrupt end to their career because of injuries doesn't seem to have rattled him one bit. Anyway, it'll undoubtedly be a joyful sight to watch him sprint across the field like a flying horse again. Unfortunately, John was about to realize a lifelong dream to play in the NFL just before receiving his diagnosis. With the 44th overall pick in the 2022 NFL Draft, he's all set to wear colors of his dream team, the Houston Texans. He's anticipated to be a valuable addition to the Texans, but that'll probably have to wait for the time being. Speaking of value, he bagged a national title for Tide in 2020. He also has 2 John Cornish trophies, an annual accolade given to the top Canadian player in NCAA football. Adding on to that, before getting drafted into the NFL, he spent 3 seasons playing for Alabama. 2,081 receiving yards and 14 touchdowns were recorded by John during his time, and we must say those are some pretty impressive stats. Yet before we could see him in action, John needs to make sure he's prepared to withstand the brutal tackles that are typical on a football field. And now, some details about the disease. Yes, it's a sort of blood cancer, just to be clear, but there's no need to freak out. And before your imagination gets the best of you, allow us to add that it's a pretty frequent sort of sickness affecting around 600 to 800 individuals annually in only the United States of America. John's also fortunate in terms of his access to treatment, as APL is considered a condition that is simple to treat in the present era thanks to significant developments in the medical world. According to statistics, 90% of patients report a complete remission, and almost 80% or even more in low-risk cases have been cured, so all hope isn't lost. Males around the age of 40 are generally known to be more susceptible to the condition, but it seems that our top athlete ran into some bad luck with this one. The aggressive form of leukemia, known as acute promyelocytic leukemia, or APL, is distinguished by a rise in the number of immature blood-forming cells in the blood and bone marrow. Since bone marrow produces the majority of our blood cells, muscles. Additionally, this manifests itself with an increased risk of bleeding and the formation of clots. In addition to excessive fatigue, some individuals may also report appetite and weight loss. The cause of the disease is related to genetics when the chromosomes number 15 and 17 undergo a translocation. Sounds awful, but we hope John's back in no time. And now, in other news. First up, Jamal Adams left camp to attend to his fingers. Apparently, the Texans aren't the only team struggling with their players' medical conditions. The Seattle Seahawks are one such team who were left without their safety, Jamal Adams, who left the training camp to seek some more opinions on his left hand fingers. Coach Pete Carroll of the Seahawks stated that it's unclear for how long he's gone and whether there'll be an additional surgery. He revealed that the Jamal had joined the workout session for the first day of the training camp, however, he didn't show up the next day, and added that Jamal had gone to see some specialist about his fingers, which didn't feel right to him. Unfortunately, Adams underwent multiple surgeries last offseason. One of those surgeries he underwent was for a shoulder injury that made him sit out for 5 games last season. As for his fingers, Adam received a procedure to fuse 2 of them from his left hand after suffering multiple dislocations. It's unfortunate to see NFL players struggling with their health from the injuries received during the play. It's also being reported that while the Seahawks didn't use him much as a pass rusher last season, he's all set to be used in a more aggressive role this season. And now for an update on the Watson discipline case. Looks like health isn't the only issue NFL teams are facing these days. Cleveland Browns quarterback Deshaun Watson's under scrutiny for accusations of sexual misconduct made against him. The decision on the allegations, while it's expected sooner, is being speculated to come out next week. Insider sources revealed that the retired Judge Robinson would be taking another week before issuing a ruling on the case, hearing that concluded last month. Nothing could be said for sure about what the ruling will entail for Watson. However, it's being speculated that Watson will come out of the hot water unscathed, since 2 separate grand juries declined to indict Watson earlier. Watson had been accused of sexual harassment and assault by some 24 massage therapists. Out of these, about 20 lawsuits have already been settled by the athlete. All eyes are now on the verdict of this disciplinary hearing, which will at least take 1 more week before it's passed. And finally, astonishing self-medication practices in the NFL. Ricky Williams has recently made waves in the football world for revelations about a self-medication trend prevalent in the NFL. While talking on the Sports Seriously, a USA Today show, Ricky claimed that a majority of NFL players used cannabis to subdue the pain from playing football. Recalling an instance from when he was still a rookie, he revealed that a veteran player who was later inducted into the Hall of Fame invited him over to his house and advised him to take care of himself in the NFL. He then took out cannabis, rolled a joint, and even added a crushed Vicodin in there before passing it over to Ricky. He also narrated a story from his final years at the Raven, that once as he was leaving the facility, he noticed a few players heading in with a plate full of brownies to watch a film. It's worrisome to see that NFL players are turning to marijuana in order to stay in the game, fearing an abrupt end to their career because of an injury. Before the benefit of athletes' health, we think it's time to halt this trend and implement remedial measures. That's a wrap for this video. What are your thoughts on John Metchie's diagnosis and the possibility that he'll sit out the whole season? Let us know in the comments below. Make sure to give this video a thumbs up and subscribe to our channel for more videos like this. See you in the next one.